Michigan daycare and childcare operators have new guidelines to follow when it comes to quarantine and isolation. The update from the state comes a week after 13 on Your Side looked into the mixed messages that prompted a Kent County preschool owner to close.
13 on Your Side's Charlie Tinker has followed this from the very beginning, reached out again today for an update. He's joining us now live with what he has learned. Charlie.
Yeah, Kirk, that's right. Tricia Dart owns Little Ones Learning Preschool and says the update came as a bit of a relief after going through a process she agreed felt a bit more like stumbling around in the dark, playing phone tag just to get those answers.
I reopened yesterday.
Tricia Dart is busy just getting back into the swing of things.
After being closed for 15 days.
Reopening her Comstock Park preschool to waiting parents Monday.
I was happy to see that.
It was a different story when she reached out to 13 on Your Side earlier this month.
I just wish I had some guidance.
After a COVID diagnosis and the family had her shut down and cold calling agency after agency looking for what to do.
We used to have guidance upon guidance upon guidance, and now there's not a whole lot of anything when it comes to the early childhood profession.
Despite recent guidance updates for everybody else, reduced quarantines and policy tweaks, Dart was surprised to find the latest guidance for her under 5 clientele was this 5-month-old document put out by Laura.
I mean, we have the kids that are not able to be vaccinated yet.
In a policy fix out this week, the state's now advising children and staff members who show symptoms to immediately isolate and get tested regardless of vaccination status. If they test positive, they should isolate for 10 days. Contact with a positive case means a 10-day quarantine, the only exception if they have had COVID in the last 90 days.
This is so hard on families with young children.
That was Dr. Andrea Hadley, who has her hands full with a record number of pediatric patients at Helen DeVos Children's Hospital. The update, says Hadley, reinforce established best practices to keep kids out of the hospital.
Until we can protect these kids, mitigation strategies that we know work are really our only line of defense.
Now it's like we are kind of unified again with expectations.
Too little, too late to clarify Tricia's situation. She's hopeful the new rules will help with future misunderstandings, but wants to see more coordination between the agencies calling the shots. Yes, those new guidelines also double down on some of the practices that have been in place for a while, which scientists acknowledge work, hand washing, social distancing, and yes, masking as well.